All right, good day everyone and welcome to the sixth session of UPM SILab's IOL Fun Webinar Series 2025 to present us the cybersecurity for healthcare in the age of AI or artificial intelligence. Let us virtually welcome Professor Susan Pancho-Festin. Over to you, Professor Susan.
Thank you, JR. Good morning. I'm Susan Pancho-Festin, as JR has mentioned. I'm part of the Computer Security Group, and I'm also a faculty member at the Department of Computer Science at the College of Engineering in UP Diliman. I thought that I would focus on a more specific area, discussing how artificial intelligence or AI has affected the healthcare industry. These are the topics I want to cover. So first, let me talk about how AI has already changed the healthcare landscape. So here we have a summary of the different domains or top 10 applications of AI in healthcare. So here's a breakdown of how these AI trends are mapped in terms of percentage. Minority would be cybersecurity or personalized healthcare, but that's expected to change over time. So this is one such startups in the medical diagnostics space that is using AI to enhance or assist the health practitioners. And then they've also built an app for healthcare providers and patients so that they could make the patient records more portable. August of 2024, Dr. Jaime Montoya presented several AI-driven innovations that are being supported by the Department of Science and Technology that have some AI aspect related to healthcare. So one project is called the AINA, the Artificial Intelligence Nutrition Assistant. Another project is called UTAC AI, AI-assisted imaging techniques in detecting and analyzing brain tumors. Then there's a project from National University called Health PH for surveillance of public diseases for early detection of potential epidemics. And then the last project that was reported called MedHive, an AI-powered platform for procurement of medical devices or medical products or even materials. These are the 6 common types of identified security breaches in healthcare. So with or without AI, we have been increasingly using technology in the healthcare space. So even without AI, there are already cybersecurity threats. AI might help us with this risk in addressing them, but AI might also help attackers, make their attacks more sophisticated. So we have to be aware of the double-edged sword that AI provides in terms of cybersecurity. So we can see that there's an increasing trend in healthcare data breaches. So private data records of our patients are being leaked. Now, AI has a lot of advantages that could be used to benefit healthcare. Essentially, research. We could also use AI for training, so simulation for our students in the healthcare. It could help us keep track of our health. It could help in early detection. It could help in aiding our healthcare professionals in diagnosis, in decision-making, and even treatment. So there are a lot of benefits in using AI, artificial intelligence in healthcare. But there are also risks that are made sophisticated because of AI. Essentially, what AI can do is that it could also optimize cyber attack. Tools like ChatGPT that could already do code, Copilot, that could be used for good, but that can also be used for malicious intent. So there are reports out there of AI-assisted or AI-generated malware that were conceived because you gave a prompt to AI tool. And there's also risks with AI-linked devices, so there's physical safety risk as well. Then there are also AI privacy risks. Prompts of users were accidentally leaked and made visible to other users. And then because AI relies a lot on models, so there's also the theft of the models, whether the models could be manipulated or if there's bias in the models. So is this model reliable? Is this model trustworthy? And I think probably this last one is probably the most concerning. LLM-assisted phishing attacks. So large language models can make conversations appear more human, so that when you are engaging via email or even via a phone call or probably video call, you would think that it's that person who is speaking to you on the other end or communicating to you from the other end. I think with or without AI, it is important to go back to cybersecurity fundamentals. Do a cybersecurity health check for your organization. So make sure that part of that health check is to establish a cybersecurity risk awareness program in your organization. Also have an updated continuity plan. For example, if there's some ransomware that happens, what is at risk and how do we cope with it? Now, with respect to AI specifically, discuss and establish guidelines regarding how AI is used in your organization. Do your employees, do the health practitioners already use large language models like ChatGPT to write reports or aid them in diagnosis, for example? And what is the policy about that? I think it's also important to consider adopting what we call a zero trust strategy from the cybersecurity aspect. Those are my suggestions of where do we go from here. But as I mentioned, it's a very large space, this healthcare, AI, and cybersecurity. Thank you very much for listening to me this morning.
Once again, thank you. This is JR Pingal saying, catalyzing change one spark at a time. Let's keep pushing the boundaries of digital health together. See you next Wednesday. Bye. In 3, 2, 1, smile.